talking about something incredibly important, your liver. This organ works around the clock to detoxify your body, metabolize nutrients, and maintain your overall health. But did you know that certain medications, both prescription and over-the-counter, could be damaging your liver without you even realizing it? In this video, we're going to explore 10 medications that can destroy your liver and discuss the symptoms that indicate your liver is getting sick. If you or someone you know is taking any of these medications, this is a video you don't want to miss. So let's dive in and uncover the truth about liver-damaging medications and what to watch out for. 1. Acetaminophen, Tylenol, the silent liver killer. First on our list is one of the most commonly used medications in the world, acetaminophen, also known as Tylenol. This drug is available over the counter and is widely used to treat pain and reduce fever. While it may seem harmless because of its popularity, acetaminophen is actually one of the leading causes of liver damage worldwide. Acetaminophen toxicity can occur when you exceed the recommended dosage, which is easy to do since it's found in many combination medications for colds, allergies, and flu. When taken in excess, acetaminophen overloads the liver's detoxification pathways, leading to the production of toxic byproducts that can destroy liver cells. Even a relatively small overdose can lead to acute liver failure. Chronic use of acetaminophen, especially when combined with alcohol, can result in chronic liver damage. Symptoms of acetaminophen-induced liver damage include nausea, vomiting, loss of appetite, and jaundice, yellowing of the skin and eyes. If untreated, acetaminophen toxicity can lead to life-threatening liver failure. Always read the label carefully and avoid taking multiple medications that contain acetaminophen. Stick to the recommended dose and avoid drinking alcohol while on this medication. 2. Statins, cholesterol-lowering drugs. Next on the list are statins, a class of drugs used to lower cholesterol levels in people at risk of heart disease. Statins like atorvastatin, Lipitor, and simvastatin, Zocor, are prescribed to millions of people around the world. While they are effective at reducing cholesterol, they can also have a negative impact on your liver. Statins work by inhibiting an enzyme in the liver that's involved in cholesterol production. But in some people, statins can also lead to elevated liver enzymes, indicating liver damage. Over time, this can cause hepatitis or liver inflammation, which can progress to more serious liver disease if not monitored. Symptoms of liver damage from statins can include dark urine, fatigue, and pain or discomfort in the upper right side of the abdomen, where the liver is located. If you're taking statins, your doctor should regularly check your liver enzyme levels through blood tests. If you experience any unusual symptoms, don't hesitate to discuss them with your healthcare provider. 3. Antibiotics, the hidden danger. Antibiotics, lifesavers though they may be, are not without their risks. Certain antibiotics, especially those in the fluoroquinolone class such as ciprofloxacin and levofloxacin, can be toxic to the liver. These drugs are used to treat a variety of bacterial infections, but prolonged or improper use can result in drug-induced liver injury, DILE. Antibiotics can cause hepatotoxicity, which occurs when the liver is unable to process the drug properly. The liver can become inflamed, and liver cells can be damaged or die. In some cases, antibiotic-induced liver damage can lead to liver failure, though this is rare. Signs of liver problems caused by antibiotics include itchy skin, jaundice, dark-colored urine, and pale stools. These symptoms indicate that the liver is struggling to process the medication. Always take antibiotics exactly as prescribed and avoid unnecessary use. If you have a history of liver problems, make sure your doctor is aware before starting any antibiotic. 4. Methotrexate for arthritis and cancer. Methotrexate is a powerful medication used to treat rheumatoid arthritis, psoriasis, and certain types of cancer. However, this drug is notorious for its potential to cause liver damage, especially when used long-term. Methotrexate can accumulate in the liver over time and cause fibrosis, scarring, or even cirrhosis, severe liver damage in some patients. Liver toxicity is a well-documented side effect of methotrexate, particularly in people who take the drug for autoimmune diseases. Signs of methotrexate-induced liver damage include nausea, fatigue, and an increase in liver enzymes detected through blood tests. In severe cases, it can lead to jaundice and severe liver failure. Patients on methotrexate should have regular liver function tests to monitor for potential damage. Discuss with your doctor about ways to mitigate liver damage, such as lowering the dose or taking folic acid supplements. 5. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are another group of medications that can cause liver damage when taken in excess. Commonly used NSAIDs include ibuprofen, Advil, naproxen, Aleve, and aspirin. These drugs are popular for their pain-relieving and anti-inflammatory properties. But chronic or high-dose use can be dangerous for your liver. NSAIDs can cause drug-induced liver injury by reducing blood flow to the liver or causing direct toxicity to liver cells. Long-term use can lead to elevated liver enzymes and, in rare cases, liver failure. If you're taking NSAIDs regularly, pay attention to signs of liver stress, such as yellowing of the skin and eyes, persistent nausea, or dark urine. To avoid liver damage, stick to the lowest effective dose for the shortest time necessary, and always follow the instructions on the label. If you're using NSAIDs frequently, consult your doctor to discuss potential alternatives. 6. Anti-seizure medications. Anti-seizure medications like phenytoin, carbamazepine, and valproic acid are life-saving for people with epilepsy or other seizure disorders, but they come with a risk of liver toxicity. These medications can cause an immune response in the liver that leads to inflammation and damage to liver cells. In some cases, they can cause acute liver failure, especially in patients who take high doses or who are on these medications for long periods. Signs of liver damage from anti-seizure medications include jaundice, swelling in the legs and abdomen, and unexplained fatigue. If you or a loved one takes anti-seizure medications, liver function tests should be part of your regular health monitoring. Your doctor can help adjust your dose or switch medications if liver problems arise. 7. Oral contraceptives. Oral contraceptives, or birth control pills, are used by millions of women to prevent pregnancy, but they also have the potential to harm the liver in certain cases. This is especially true for women who take them over a long period or have pre-existing liver conditions. The synthetic hormones in birth control pills can cause cholestasis, a condition in which bile cannot flow properly from the liver. Over time, this can lead to liver inflammation and even liver tumors in rare cases. Symptoms of liver damage from birth control pills include dark urine, light-colored stools, and upper abdominal pain. If these symptoms occur, it's important to stop taking the pills and consult a healthcare provider. If you're taking oral contraceptives and notice any signs of liver distress, talk to your doctor about alternative forms of contraception. Regular liver function tests are also recommended for long-term users. 8. Antidepressants. Antidepressants are critical for managing mental health conditions like depression and anxiety, but certain antidepressants, including tricyclic antidepressants and selective serotonin reuptake inhibitors, SSRIs, can affect the liver. Some antidepressants can lead to an increase in liver enzymes, signaling that the liver is under stress. In rare cases, this can lead to more severe forms of liver injury, including hepatitis. Symptoms of liver damage from antidepressants include jaundice, fatigue, nausea, and abdominal pain. It's important to have your liver enzymes checked regularly, especially if you've been on antidepressants for a long period. If you're on antidepressants and experiencing any unusual symptoms, consult with your healthcare provider about alternative medications or ways to protect your liver. 9. Anti-tuberculosis medications. Drugs used to treat tuberculosis, TB, such as isoniazid and rifampin, are essential for eradicating the disease, but they can be highly toxic to the liver. These drugs can cause hepatitis and, in severe cases, liver failure, particularly in patients who are on long-term TB treatment. The risk is higher in older adults and those with pre-existing liver conditions. Common signs of liver damage from anti-tuberculosis medications include jaundice, abdominal pain, and loss of appetite. Regular monitoring of liver function is crucial while taking these drugs. If you're on anti-TB medications, work closely with your doctor to monitor your liver health through blood tests and report any symptoms of liver distress immediately. 10. Herbal supplements. Many people turn to herbal supplements thinking they are safer than prescription medications, but some herbs can cause significant liver damage. Kava, green tea extract, and black cohosh are just a few examples of herbs that have been linked to liver toxicity. These supplements can cause drug-induced liver injury by overloading the liver's detoxification pathways. In some cases, they can lead to liver failure and even the need for a liver transplant. Signs of liver damage from herbal supplements include fatigue, jaundice, dark urine, and abdominal pain. It's important to be cautious when taking herbal supplements, especially if you're already on medications that affect the liver. Always consult with a healthcare provider before starting any new supplements, especially if you have a history of liver problems. Thank you for watching, and remember to share this video with anyone you think might benefit from this information.